Okay, now, very good case. If you're a 34-year-old male who have a severely pruritic lesion in his hands, and you just been to Miami Beach, and when I examine you, I found serpentinous reddish brown elevated lesion.
Some what?
Serpentinous reddish
Oh,
brown
okay.
elevated lesion which
Mm-hmm.
are evident bilaterally on upper extremities.
Mm-hmm.
What is that?
What do you call it? Is it ankle and something Brazilian? See how do you spell that?
Good job. Yeah, yeah, and ankylostoma brasiliensis. Yeah,
I cannot pronounce that.
yeah,
Yeah.
cutaneous larva migrans.
Mm-hmm.
So if you are 22-year-old male who have multiple sexual partners, what do you think? What test should I order now?
If you're 22
Mm-mm.
year old, female,
Male.
male,
Yeah.
and what else? Multiple sex partners,
Yeah. So
chlamydia, GC chlamydia.
you wanna order HIV. That's an important. So what? When do you order HIV? When do you screen people for HIV?
I know they said maybe you can do it one time, age 15 to 65. And then also people with high risk, men that have sex with men, multiple sex partners, if they are diagnosed also with any STD, infections, you can go ahead and also do HIV at the same time.
Yeah. Initial screening for 15 to 65. Tr- Treatment of TB or treatment of another STD. You wanna order that screen, and then annual screening for people who use sex for money, partner of HIV positive, male sex with male, IV drug abuser,
Mm-hmm.
part who someone who have more than one partner since last HIV test. You gotta screen them annually. Homeless shelter living, correctional facility, incarceration. Then
Mm-hmm.
you wanna do annual screening. Additional, like people, pregnant female, occupational exposure to blood or bloody fluid, any new STD symptoms, okay, and suggested prior to any sexual relationship. That's the thing. Okay, now, if you're a 53-year-old woman with long standing rheumatoid arthritis,
Mm-hmm.
you came to the emergency room due to seizure, you had cough, fever, night sweats. When I ordered CT of the chest, I found multiple nodules. CT of the brain shows left temporal lobe abscess. Bronchoalveolar lavage show grow partially acid fast gram positive branching rods.
Mm-hmm.
So how do you treat that?
So this would be nocardia, and you give them Bactrim.
Yeah, TMP, SMX. Yeah. Now, if you are a 48-year-old obese woman, uh, just like, ouch. Okay, who had urinary frequency, burning, severe nausea, weakness, costovertebral angle tenderness. Okay, so I gave you ceftriaxone, but 2 days later you felt much better, and the urine culture shows gram positive E. coli that's sensitive to Bactrim, Cipro, gentamicin, and ceftriaxone. So what should I do now?
Oh my, that was a long one. So you've given this patient ceftriaxone,
Mm-hmm.
and she's getting better.
Yeah.
And then culture came back and is sensitive to ceftriaxone too, right?
Mm-hmm.
Bactrim. What else?
Cipro.
Cipro. Okay. if the culture comes back is sensitive to what you're already giving the patient, I guess you continue, right?
No, you don't want to continue IV med, so you switch it to
No, oh, okay.
oral Bactrim. So, uncomplicated infection, if it's mild to moderate,
Mm-hmm.
like acute pyelonephritis, there are three types,
Mm-hmm.
or let's say two types, complicated and uncomplicated, okay?
Mm-hmm.
If it's uncomplicated, then if it's uncomplicated pyelonephritis and it's mild to moderate, then you treat it with either Bactrim or Cipro. But if it's severe, then you give ceftriaxone, Cipro, Bactrim, but everything is IV. However, if it is complicated, when do we call it complicated pyelonephritis?
If they have like other medical conditions like diabetes and things like that, if they also are not getting better, and then if they also, I think, have like a hypertension, like systemic symptoms and things like that.
I love drinking water, it's my favorite juice.
I'm like, what are you drinking?
So, the complicated one is that if you have a recent urological procedure, or if it's hospital acquired, if there's a renal impairment, azotemia, if there's immunosuppression, comorbid diabetes, okay? Then that's called complicated. Complicated, there's two types. There's moderate and severe. Moderate, you want to give ceftriaxone or cefepime or Cipro, like levofloxacin, ciprofloxacin. But if it was severe, how do I treat it?
Yeah, you give them IV something, right? Okay, I think do you add also anti-pseudomonas?
Smart. So you give them IV ampicillin, sulbactam, ticarcillin, clavulanet, peptazo, meropenem, imipenem, aztreonam, plus minus gentamicin. That's about it. How about if a pregnant? How do you treat the pregnant pyelonephritis?
So if they're pregnant, you give them any of those ones. What do you call it? You can give them ceftriaxone. You can give them I think also amoxicillin. No Bactrim. You don't give them Bactrim. You don't give them fluoroquinolones. Yeah. You can also give them nitrofurantoin. And then you also do like a culture.
Yeah, you want to give them ceftriaxone plus minus gentamicin, or you can add aztreonam. That's safe in pregnancy. Okay, now it's an important case. A 50-year-old male who was admitted to the ICU for peptic ulcer perforation. However, he developed nausea, vomiting, and profuse watery diarrhea. So what's going on here?
So maybe C. difficile, colitis.
So what are the risk factors for C. difficile colitis?
Recent antibiotic use, recent hospitalization, and also being on PPI.
Yeah, so you want to do the stool toxin assay testing.
Okay.
Yeah, that's how you want to treat it. And the clinical presentation, they have fever, abdominal pain, watery diarrhea, leukocytosis. Can complicate it to toxic megacolon, can be that.
What about treatment? What do you do?
Can be white pseudomembranous, can be on sigmoidoscopy. You can have pseudomembranous. Yeah,
treatment.
Okay. Yeah, treatment is vancomycin.
So now metronidazole is not the first line anymore, right?
No, not the first line anymore. They changed the. Okay, so if you're a 26-year-old male who's taking INH and developed numbness, tingling, and ataxia,
Mhm.
so how do you treat that?
So you add vitamin B6. They have a pyridoxine, whatever deficiency.
Okay, so if you're a 25-year-old male with HIV who had headache, left-sided weakness, neuro exam shows decreased power, hyperreflexia, upgoing plantar in the left upper and lower limb. CT shows multiple ring enhancing lesion.
Mhm.
How do you treat?
So this one I'm saying is toxoplasmosis gondii, and you have to treat with pyrimethamine and sulfur. Okay, you going to bed? All right, good night. Sorry, my son. Yeah,
Okay, yeah,
yeah,
sulfadiazine and
and
permethamine.
pyrimethamine or whatever you call that.
So if you're a 23-year-old HIV female, when I
Mhm.
examine you, there's dullness to percussion and the bronchial breath sounds on the right lower base. So what's causing that?
Female, HIV with do you say fever and cough?
Yeah,
Okay, and they have right lower base.
yep,
Lower base what?
dullness.
Dullness. Just right lower base dullness.
Yeah, so that's a strep pneumo.
Eh, okay. I was gonna wait for you to say, is it lower base consolidation or something else or whatever?
Yeah, so dullness mean consolidation. Okay, because it's dullness, it's most likely strep pneumo. It's not a
Okay.
PCP, so don't be confused. Okay, if you are a 44-year-old male who
Mhm.
have slowly enlarging macule, okay, and the macule has changed in color from pink to violet,
Mhm. So
and
that will be,
what is that?
if it has changed from pink to violet, color will be Kaposic sarcoma HHV8.
Excellent.
Kaposic sarcoma.
So if you are a 45-year-old male with low-grade fever, night sweats, abdominal discomfort, diarrhea, cough, and weight loss, your CD4 is 22. What could have prevented that?
Fever, cough, diarrhea.
Yeah,
What else?
CD4 of 22.
Oh well, what would have prevented that to be on heart therapy?
And
So
and
maybe the patient has opportunistic infection.
yeah, and azithromycin,
So
because this is
yes, yes.
because this is mycoplasma pneumonia.
Mac.
So if you're a 32-year-old woman
Mhm.
with weight loss and CD4 of 30, so what antibiotic you want to give her?
If CD4 is 30, you
Mhm.
want to do prophylactic medications. You want to do TMP, SMS, and then also azithromycin. Bactrim and azithromycin. And yeah, those are the two major ones. Then if they're having other symptoms, you can give them acyclovir if they're having issues with like vesicles and things like that. But the major ones are Bactrim and azithromycin.
Yeah, but you're missing one. If the patient
Is it itraconazole
wow, good job, yeah.
for histo?
Yeah. If the CD4 less than 150. Yeah, if the patient in Ohio or Mississippi River Valley.
Mhm.
Yeah, other than that, you give Bactrim for toxoplasma.
Mm.
It's less than 100. PCP less than 200. Okay. PCB can have oropharyngeal candidiasis. Toxo, you have positive toxa IgG. Okay.
Mhm.
If you are a 55-year-old Asian with mitral stenosis due to rheumatic heart disease, okay, you
Mhm.
had a dental surgery, and then you presented with fever, chills, fatigue, and mitral valve vegetations. So
Mhm.
what's causing that?
Endocarditis due to any of the bacteria in the what do you call it? Um, strep viridans. So it can be strep mutans, strep mythis, strep something, you know.
Sanguis to salivarius.
Oh my.
Yeah, those are. If you're a 32-year-old male who's gardener, present with painless ulcer on the finger of your right hand, lesion started as a painless papule and then became ulcerated. On
Mhm.
exam, there is non-tender subcutaneous nodule
Mhm.
are palpable proximal on your right forearm.
Mhm.
What's diagnosis?
Sporotris.
Yes, portricosis. So, what
What's
are
the treatment again for that?
you give them itraconazole?
Hmm?
You give them itraconazole.
Itraconazole, right? I remember in step 1 they said it's potassium iodide.
Which one?
Sporotris, when we took the step 1, treatment was potassium iodide, you know, on first aid. Now they
Oh,
changed to itraconazole.
yeah, yeah. You give them like for 4 weeks or so, something like that. Okay, now. So if you're a 72-year-old male with right ear pain and ear discharge, when I examine you, there is a granulation tissue on the lower part of external auditory canal. So what bacteria causing that?
Pseudomonas? Is that what you're asking me?
Wow, good job. You
Uh,
you
I
answered
tried
before
to.
I drink some water. So you didn't let me drink some more.
You are so funny. Are you gonna pee all night tonight drinking all this water?
Maybe, yeah.
Are you drinking just water? Are you drinking tea?
No, I just like water, take sips of water. I like to hydrate
Oh.
myself. Okay, if you're a 30-year-old male, you know they say if you drink water and
Hmm.
smile, it's gonna increase your concentration while you're studying up to 16 times.
Really?
Yeah.
If you drink water and smile.
Yeah.
Interesting.
Yeah, okay. Now, if you're a 30-year-old male with 2 months of lower extremity swelling and skin lesion, you had weight loss, and you're unable to identify how much did you lose weight anyway. They have a this one I already asked you about. I think you know violaceous papules increased due to increased vascularity. So this is Kaposi sarcoma. They gave a picture of it, spot
Hmm.
diagnosis.
Hmm.
Now, if you are a 63-year-old male with fever and right left-sided scrotal pain, you have frequency, urgency, dysuria. When I examine you, there is left scrotal swelling and tender scrotal mass. So what is causing that scrotal mass in a 63-year-old guy? What what bacteria?
Acute epididymitis, E. coli.
Yeah, if it's more than 35, but if it's less than 35, then it could be Neisseria.
JC.
It could be gonorrhea or
Chlamydia.
chlamydia. Okay, good question. If you're a 42-year-old male with fever, sore throat, malaise, and skin rash, when I examine you, I find non-pruritic maculopapular rash over the entire body, including palms and soles. Generalized lymphadenopathy.
Male sore throat, rash on palms and soles. Is this like syphilis, secondary syphilis? Or, hold on. Give it to me again. 42-year-old male with fever, sore throat, rash on palms and soles. What else?
Generalized lymphadenopathy.
Mm-hmm.
Yeah, it's syphilis, you're right. Whenever you hear a rash on palms and soles is very rare to have a rash. So there are very few things that can cause rash in palms and soles.
Your cars, right?
Cars, yeah, you remember what are they?
Coxsackie
Yeah.
virus, rickettsia, syphilis. And what is the A again?
Kawasaki A.
Yeah, okay. Coxsackie A. Yeah.
Yeah, if you're a 15-year-old male with fever, sore throat, headache. Now, when I examine you, there is a dusky red target-shaped skin lesion over all four extremities.
Dusky red targetoid lesion
Chest
over. Okay, go ahead.
Chest X-ray shows interstitial infiltrate in the left lower lobe. Gram stain shows polymorphonuclear cells with no organism. So what's causing that?
Oh, mycoplasma pneumonia.
Good job. Yeah, I like that you pick it up so fast. That's good. Yeah, you know, some like I did that like with other students. They're not able to pick it up, but that's smart. That indicates your advanced level. Good job. Okay, if you're a 26-year-old male with 1 week of dysuria and increased frequency with a mucopurulent discharge at the urethral meatus. So, what's diagnosis?
Yeah, can be gonorrhea, can be chlamydia. So you have to do that.
Yeah, so urethritis in men can be caused by gonorrhea, chlamydia, mycoplasma genitalium, and there is trichomonas, rare. It causes dysuria, discharge, urgency, increase of frequency. So you gotta do urinalysis, gram stain and culture, and nucleic acid amplification testing. You treat with Zithro or Doxy plus ceftriaxone. That's about it. Now, good question. If you're an 18-year-old woman with acute onset of headache, muscle pain, nausea after returning from a camping trip, your blood pressure 90/60 with neck stiffness, what's diagnosis?
Okay. So this is a how many year old female?
18.
Okay. Headache, muscle pain. Huh?
Yeah, and neck stiffness.
Neck stiffness. Okay. Meningitis.
Yeah, it's a meningococcal infection.
Like severe meningitis.
Good question. If you have malaise, non-productive cough, abdominal pain, diarrhea,
Malaise, non-pruritic cough, okay?
shortness of breath, chest X-ray shows patchy infiltrate in the left lung with hyponatremia.
Yeah, Legionella.
Yeah, so this is how Legionella present. Usually there's a recent travel, cruise or a hotel. Do you know what's the name Legionella came from? Where did that came
They said those is it like some people that went on a pilgrimage or something like that, legionnaires or
from?
right?
Yeah, I remember like there
They
was
went
like
on a pre yeah, like on a
yeah,
pilgrimage or whatever, and they all got sick from the water heater from the hotel or something.
yeah, there was the richest guys
Hmm.
in France and stuff like that. Yeah, so travel contaminated with water, hospital, nursing home, so those types of things. So they have fever, bradycardia, relative to high fever, confusion, neurological symptoms, GI symptoms, diarrhea, and doesn't respond to beta-lactam and aminoglycoside. Lab, they have hyponatremia, hepatic dysfunction, hematuria, proteinuria, and gram stain shows no organism. Okay. Now, if you're a 24-year-old male with fever, drenching sweat, malaise, and jaundice with dark colored urine, you're being bitten by a tick 2 weeks ago, surgical history includes splenectomy, and exam is fine, everything is fine except jaundice. So, what's diagnosis?
Drenching sweat, jaundice. I'm thinking hepatitis.
So, it's Long Island in New York, fever, drenching sweat, malaise. Last few days noticed jaundice, dark urine. You had tick bite, okay, post tick bite.
Hmm.
Jaundice, what is it?
Oh, hold on. Is it splenectomy? Is it what do you call it? I know there is babesiosis.
Wow, I knew you were gonna say it. Smart, yeah.
The one that looks like malaria, but it's not malaria.
Yeah, it's babesiosis. Now, if you're a 54-year-old woman with an area of erythema and a duration below the right mandibular angle with serosanguinous fluid draining from a small defect in the skin near the lesion, needle aspiration of the lesion show gram-positive anaerobic branching bacteria. How do you treat that?
Penicillin, actinomyces.
What are the risk factors for that?
Oh my. I hate risk factors. Stop asking me risk factors. I'm kidding. So I think they said something like a poor dentition, manipulation of the like oral area, like tooth extractions and things like that. That's all I know.
Yeah, so the risk factors is dental caries, extraction,
Mhm. Mhm.
infected tooth, gingivitis,
Mhm.
diabetes, malnutrition, local
Mhm.
tissue damage. Presentation slowly progressive, non-tender, indurated mass extends through tissue planes to form an abscess, and mandible is the most common site. Now, if you are a 47 African American farmer from Mississippi with a 3 week of malaise, cough, fatigue, shortness of breath, Transbronchial biopsy shows lymph node with non-caseous granuloma. What do you think is causing that?
So, was there any X-ray?
No. It's non-caseous granuloma.
Non-caseating granuloma can be
Worsen with a steroid.
Okay, then it's histo.
Yeah, it's histoplasma.
Yeah, because histoplasmosis.
Yeah, now if you're a 49 male with fever, weight loss, and anorexia, and
45
pain,
male.
Yeah.
Okay, fever, anorexia, muscle pain.
Yeah, and then you had the Streptococcus bovis in the blood culture. What's next step?
Colonoscopy.
Yeah, we do colonoscopy. Okay, now if you're a 34-year-old presented with periodic fever, sweating, you just came from Kenya, hemoglobin is low, bilirubin is high. What is that?
Malaria.
So how do you treat that malaria?
How do you treat it? You give them what do you call it? It depending on where. Okay, you're gonna give them either mefloquine, or you can do I think you don't do quinidine anymore. You can do atovaquone plus something else, or you can do mefloquine, or you can do doxycycline. All those things, you can use it to treat. Right?
How do you diagnose it?
How do you you do that? You do a blood smear.
Yeah, thick.
And you see the malaria.
Thin.
Thick and thin prep.
Yeah, thick and thin.
Thick and thin prep.
Yeah, and then this is just a second. Let me see. Let me put that here. Yeah, you give atovaquone, doxycycline, mefloquine, chloroquine, and insecticide-treated nets. Household incidents. Okay, so that's the thing. The presentation in children, they have seizure, coma, hypoglycemia, metabolic acidosis. In adult, they have jaundice, acute renal failure, and acute pulmonary edema. Clinical features can cause periodic febrile paroxysm and non-specific headache, fever, nausea, abdominal pain, myalgia, pallor, petechiae. It is transmitted by Plasmodium falciparum, okay, or infected Anopheles mosquitoes. So that's about it for this. Now, if you are a 31 HIV positive with fever and headache, and you have progressive confusion and difficulty walking, what could have most likely to prevent this patient condition?
Fever, headache, and difficulty walking.
Yeah, and the single ring enhancing lesion on the
single enhancing lesion can be is it CNS lymphoma?
No, that's still toxoplasma. So you give TMPSMX.
It's not toxoplasma. Is multiple, is it not? It is multiple.
Yeah.
Single is CNS lymphoma. Yeah, I know that for sure.
Yeah, you're right. But this, they had it on the image, only it was single. Okay, but because of the fever, headache, confusion, so that's the thing. So that's why you gotta order the toxoplasma IgG at the time of diagnosis, because it could be reactivation of the old toxoplasma. Okay, so that's, yeah, you're right. But
Yeah, the
for
CNS lymphoma will also give you fever, headache.
yeah, you're right. Yeah, but they had the picture single.
Really?
They did not bring other options to suggest CNS lymphoma.
Okay.
So I guess that's why okay. Now, if you're 25-year-old male who had an injury to your fist after a fight bite, they call it. So, what antibiotics you give?
Augmentin.
Yeah, amoxicillin. That's okay.
Mm.
Now, if you are a 57-year-old male with fever, non-productive cough, shortness of breath, headache, abdominal pain, and diarrhea with hyponatremia, so how do you treat that?
You give them what do you call it? Macrolide.
Oh, you give them levofloxacin because this
Oh,
is Legionella.
I don't know why I'm always saying macrolide when it comes to Legionella. But you can also do that, right? But first line is fluoroquinolones, right?
Yeah, this is
Okay.
Legionella disease. You can diagnose it with Legionella urine antigen testing.
Fluoroquinolones. I need to just
Yeah,
put that in my head.
relative bradycardia, diarrhea, confusion. That's it.
Yeah.
Okay, if you are a 30-year-old HIV, when I examined you, I found 1 to 2 cm round, reddish, vascular, non-tender, friable, exophytic nodule.
Mm-hmm.
How do you? What is diagnosis?
Bacillary angiomatosis.
Yeah, you treat it with erythromycin. What are the treatment options for latent TB?
Okay, latent TB, you can do INH times 9 months, right?
Yeah, or if there's an INH resistance, then you want to do rifampin for 4 months.
Mm-hmm.
Or you can do INH plus rifampin for 4 months. Or you can do INH plus rifabutin weekly for 3 months under direct supervision. Not recommended for HIV patients. And then you add pyridoxine if the patient have diabetes, uremia, alcoholism, malnutrition, HIV, pregnancy, or epilepsy for INH. So now, if you are a 46-year-old male with necrotic turbinates and right eye chemosis and proptosis, nasal turbinate shows hyphae, how do you treat that?
You give them amphotericin B.
Surgical debridement plus amphotericin B.
Mm-hmm.
Now, if you're a 55-year-old male who's been unconscious, pulseless, not breathing. Okay, when I do the autopsy, you found fluid-filled cyst in the brain parenchyma. What's diagnosis?
Fluid-filled cyst.
Yeah, this is a neurocystosarcosis.
Neurocystosarcosis, yeah.
Already patient died, so then you diagnose. Now, 22-year-old male who had fever, sore throat, and malaise. Okay, when I examined, there is petechiae with streaky hemorrhage and blotchy red macule.
Petechiae with what?
With the blotchy red macules. Palatal petechiae with the blotchy red macule. Tongue.
Blotchy red?
Yeah. Tonsils are enlarged and enlarged lymphadenopathy. Hemoglobin 13, leukocytes 14,000. So, what complication of this condition?
Man, you were so fast.
So this is like a 22 young guy with sore throat, malaise, and enlarged lymph node posterior to the sternum.
Infectious mono?
Yeah, they are increased risk for autoimmune hemolytic anemia.
What about splenic laceration?
Yeah, they can have that too. Yeah. So if you're a 27 HIV male with low-grade fever, watery diarrhea, abdominal cramps, Abdominal examination shows minimal tenderness diffusely. So what's next step?
Stool, O and P.
Yeah, of an parasite because
Crypto,
uh
Sporidium.
yeah, Cryptosporidium parasite. Now, if you're a 38-year-old woman with headache, low-grade fever, and CSF shows encapsulated yeast, how do you treat that?
So this will be cryptomeningitis. So you will do amphotericin plus flucytosine
Yeah,
for induction
ampicillin,
therapy.
ampicillin plus flucytosine. Good question. If you are a 45-year-old Mexican female, when I examine you, there is hepatomegaly. Liver shows a smooth, round, big cyst with daughter cysts within it. So what's your occupation?
What is your occupation? Maybe you are a farmer or whatever that got to get in touch with dogs.
Yeah, sheep breeder. They're an increased risk for this, called Echinococcus granulosus.
And how do you treat it?
The Echinococcus granulosus, like if there's a risk of, if the cyst is so big, symptomatic, right? Yeah, if it's symptomatic, you can aspirate it, and then you give them albendazole.
Okay.
With for sure. Okay, so that's and then let me just give like those are miscellaneous questions. If you have hemoglobin of 16, okay, with a small testis, so what's diagnosis? This is steroid abuse, causes hemoglobin high and small testicular volume. Okay, so that's the end of the first part of infectious diseases, and let's do a rapid review actually.
Yeah, so then go to bed.
Yeah, so that's we we talked about cutaneous larva migraine, have serpiginous reddish lesion. We talked about HIV testing, TMP-SMX for nocardia. Switch to Bactrim when stable for pyelonephritis. C. difficile, treat with Vanco. You add pyridoxine. Sulfadiazine permethamine for toxa. HHV8 violent. Azithro with CD4 2020. 22, I mean. Asyplenic adults, you gotta give them pneumococcal, H influenza, meningococcal, influenza, and hepatitis A virus, hepatitis B virus, and Tdap. Strep mutan if you have dental and infective endocarditis. Spore trichosis if you have papule that goes to ulcer. Pseudomonas for malignant otitis externa. E. coli for prostatitis. Palms and soles rash with lymphadenopathy, that's syphilis. Okay, interstitial infiltrate with headache, that's a mycoplasma. Relative bradycardia and Legionella. We talked that babesiosis present as fever, jaundice, malaise, mostly in splenectomy patient. Penicillin for actinomyces. Histoplasma present with sarcoidosis worsened to steroid. Colonoscopy if you have bovis endocarditis. Malaria causes periodic fever. Levofloxacin for Legionella. Bacillary angiomatosis present with reddish, vascular, non-tender, friable, exophytic nodule. Fluid-filled cyst in neurocysticercosis. Infectious mononucleosis can cause hemolytic anemia. Ovine parasite for watery diarrhea in HIV. If you are a sheep breeder, you may have a high risk of Echinococcus, which is described as smooth, round, big cyst with daughter cyst within it. And last but not least, if you have hemoglobin high with small testes and some mood symptoms like aggression with low LH, that's most likely exogenous steroid use. And that is the end of the first part of infectious diseases, and tomorrow we'll finish it off. Okay, do you have any
Okay.
questions?
Nope.
Okay, so